It's not possible to shield them from the exposure to such a trauma, but it is possible to shield the response. What you can do is have them open up to you and ask questions and discuss with them about what they experienced, what they feel like actually happened. Because younger children can have a very different understanding of the event compared to older children or adults. However, avoiding the question, avoiding the situation, or avoiding talking about it is never helpful. That can actually have a very detrimental effect. Younger children, say for example 2 to 6 years of age, do not have a lot of understanding of what's going on beyond their immediate world. They have what we call in psychiatry an egocentric way of thinking. They feel like the world revolves around them. Anything that happens to them, they feel like that's what's happening to the world. So if they watch something on TV and they feel like they're fearful or they're anxious about something like that is going to happen, they're unable to separate themselves from the real situation. They also have magical thinking, so reality and fantasy kind of keep getting mixed up. So you have to be a lot more careful when you talk to that age children. As you grow up, 11 onwards, you have a little bit of concrete thinking, more logic developing, more reality testing, which becomes more apparent. So a couple of things that parents should remember: if the child is showing any behavior which is abnormal or different from their actual personality, that is something concerning. Younger children can become very dependent, they can become clingy, can have crying spells, can start to have nightmares, or can have soiling or accidents. So older children can have different behavior problems like aggression, sometimes agitation, irritability. In certain cases, they can become very socially isolated. They would tend to avoid situations which can put them in danger. Some teenagers actually go the opposite way, and they can have highly impulsive behaviors. They can go into substance abuse disorders. They can start to become suicidal, or they can have a level of anxiety which is so much that they're unable to function, resulting in school refusal, dropping their grades, inability to see future as a positive future. It becomes much more foreshortened and negative. So all these signs are concerning signs. If you feel like your child is going through any of this, it is very important to seek help, because if the sooner you seek help, the lesser the likelihood of actually developing a full-blown psychiatric disorder, if they can receive the therapy or appropriate medication if it's necessary.